In this section, we'll discuss pharmacological properties of low molecular weight heparin and compare it with unfractionated heparin. Low molecular weight heparins are derived from unfractionated heparin by process of depolymerization that results in polysaccharide chains that are smaller and more homogeneous in size. Molecular weight of low molecular weight heparins range from 1 to 10 kilodaltons with average molecular weight of 4 to 6.5 kilodaltons. This average molecular weight is different for different low molecular weight heparin preparations. Like unfractionated heparin, to be functionally active, low molecular weight heparins also need to have pentasaccharide sequence, that is binding site of antithrombin. As polysaccharide chains of low molecular weight heparin are smaller and have more uniform size, so absorption after subcutaneous injection is more predictable. It results in better bioavailability after subcutaneous injection, and it also results in predictable anticoagulant effects. So, due to these properties, low molecular weight heparin can be given by subcutaneous injection, and as it has longer half-life, so low molecular weight heparin can be given by interval injections instead of continuous infusion. Low molecular weight heparin is mainly excreted by kidneys, so its dose needs to be adjusted if used in presence of renal failure. Mechanism of action of low molecular weight heparin is quite similar to unfractionated heparin. Antithrombin 3 binds to pentasaccharide sequence of low molecular weight heparin, and it results in conformational change in antithrombin 3. This conformational change enhances anticoagulant effects of antithrombin 3. Activated factor 10 binds to antithrombin 3 and it results in inactivation of factor 10. All polysaccharide chains in low molecular weight heparin that can bind antithrombin can inactivate factor 10. However, all polysaccharide chains in low molecular weight heparin are not of sufficient length and cannot bind and inactivate thrombin. So these chains will only inactivate factor 10. However, some polysaccharide chains are of sufficient length and these chains can bind and inactivate thrombin as well. So these chains will have both anti-factor 10 and antithrombin effects. So all functionally active chains of low molecular weight heparin will have anti-factor 10 effect. However, only some chains will have antithrombin effect. Degree of antithrombin effect is different for different low molecular weight heparin preparations. In contrast to unfractionated heparin, anticoagulant effects of low molecular weight heparin are more predictable, so routine monitoring is not required. Partial thromboplastin time is not reliable for monitoring anticoagulant effects of low molecular weight heparin. As all functionally active chains of low molecular weight heparin have anti-factor 10 effect, so anti-factor 10 assay can be used to monitor effects of low molecular weight heparin. We may need to monitor effects of low molecular weight heparin in presence of renal failure and obesity. There is no specific antidote that can completely reverse anticoagulant effects of low molecular weight heparin. If rapid reversal of anticoagulation effects is required, protamine can partially reverse effects of low molecular weight heparin. In addition, recombinant factor 7 and other factor-based preparations can also be considered to reverse anticoagulant effects. Although different low molecular weight heparin preparations have some common pharmacological properties, However, each low molecular weight heparin is considered a separate drug. So indications and safety profile of each drug only applies to that particular preparation. We will briefly discuss indications of each drug separately. Enoxaparin replaced unfractionated heparin for most conditions that require anticoagulation, as it can be given by intermittent subcutaneous injections for prophylaxis and treatment of conditions requiring anticoagulation. It is used for prophylaxis of DVT in medical patients and can be used for DVT prophylaxis after major orthopedic surgery. It is also used for treatment of DVT and pulmonary embolism. Enoxaparin can also be used for treatment of acute coronary syndromes, including ST segment elevation MI. Dalteparin is another low molecular weight heparin, and it is also used for prophylaxis of DVT, including after major orthopedic procedures. It can also be used for treatment of deep vein thrombosis and pulmonary embolism. Indications of dalteparin also include acute coronary syndromes, including non-ST segment elevation MI. Tinzaparin has highest molecular weight and antithrombin effects among all low molecular weight heparins. Its indications include prophylaxis of DVT and treatment of DVT and pulmonary embolism. So all these low molecular weight heparins are used for prophylaxis of DVT and treatment of DVT and pulmonary embolism. So what are advantages of low molecular weight heparin as compared to unfractionated heparin? Low molecular weight heparins have smaller and more uniform size of molecules. So absorption after subcutaneous injection is more predictable as compared to unfractionated heparin. Low molecular weight heparin is less protein bound and is not readily picked up by macrophages and endothelial cells. So it has longer half-life as compared to unfractionated heparin. So low molecular weight heparin can be given by intermittent injections. Due to these properties, low molecular weight heparins have more predictable anticoagulation effects, so routine monitoring is not required. When we consider therapeutic effects, anticoagulation effects of low molecular weight heparin for different indications are comparable to unfractionated heparin, and bleeding complications are less in case of low molecular weight heparin. Similarly, incidence of heparin-induced thrombocytopenia is less with low molecular weight heparin. So low molecular weight heparin have several advantages as compared to unfractionated heparin, and low molecular weight heparin can be used as outpatient. So low molecular weight heparins have some advantages as compared to unfractionated heparin. However, low molecular weight heparins still can only be administered in injectable form. Also, in case of bleeding, there is no specific antidote that can completely reverse anticoagulant effects of low molecular weight heparin, as protamine can only partially reverse effects of low molecular weight heparin.